on now to Chennai. Now, this is again a trouble area for the state and for the country at large because of the huge spike in cases. The city is seeing a spike in the number of COVID deaths as well in the last 2 days. In fact, for the second time in a row on Sunday, the city recorded the highest number of deaths that it has ever recorded in the past. On 13th of June, Chennai reported 22 COVID deaths. The toll has now risen to 31 on the 14th of June. So what's also worrying is that there is a rise in the death of patients who do not have any comorbidities nor any pre-existing health conditions. Now, those are supposed to be the vulnerable groups, but even people who do not have those ailments are falling prey to the coronavirus. Let me go across to Pramod, who's joining us now with more inputs on this. So Pramod, what is the assessment that the state has done on this? Because the Chief Minister seems to be extremely dismissive of community spread, yet the way the numbers are increasing, and right now we're getting information that it's not exactly the vulnerable groups of the elderly or the ones with comorbidities, but otherwise as well, the virus is spreading.
Absolutely, it's a little bit worrisome because just like you mentioned, in the past 1 week alone, the number of positive cases in the state of Tamil Nadu is surprisingly above 1,800. A minimum we're talking about, and the past 3 days it has been 1,900 and plus. Almost 80% of this is from Chennai alone. And in the past 2 days, it was a bit more worrisome as the death toll, which was earlier a maximum of 22 in a day, has increased to 31, 38 now. And that's extremely scary because yesterday alone 38 deaths were reported. And in fact, day before yesterday, 30 cases were reported. And then we questioned about certain discrepancies because certain deaths that were reported from private hospitals, the case mentioned that the person had died back in May, be it 23rd or 25th or 28th or in June 6th. And the senior official from the health department has mentioned that it is because of delayed reporting and they are looking into the matter. So we also question whether it has anything to do with the deaths that has not yet been reported, the underreported case. The official said that the separate death committee is still actually audit committee is auditing the matter. And so far they have only got information that because the private hospitals have delayed in reporting the cases, there has been a spike. But yesterday we just saw a maximum of 1 or 2 such cases. Others were reported between the period of 10th June and upfront. So we're not exactly sure what is the reason for the rise, but officials claim that they are still looking into the matter. And even just like you mentioned, we also put forward the question about people without no comorbid conditions, without comorbid conditions also passing away, and they're only saying that they're looking into the matter.
All right, let's hope that strict action is taken to contain the spread in those groups. Thanks for joining us, Pramod. Let's